Hey guys, in this video I'm going to share my personal experience with labor and delivery. Now, everyone's experience giving birth is so unique, but many of my friends and family who are expecting and getting closer to their due date ask me a ton of questions, and I know I did the same thing when I was in their shoes. I just wanted to know exactly what to expect. I wanted to feel prepared. I took classes. I did everything I could to understand what I was about to encounter. So I thought I would go ahead and post my experience in case it might be helpful for someone. But that being said, I want to preface this video by saying that everyone's experience is so unique. Just like pregnancy symptoms can vary so much and are just completely dependent upon the individual, this story that I'm about to share is completely anecdotal. So, my baby was supposed to be due on November 21st. On the 16th of November, I was at a doctor's appointment and they checked my cervix and let me know that I was about 50% effaced, and the baby seemed to be about 7 pounds and my fundal height was right on track. At that time, the doctor also told me that if I had been more effaced, she could have done a membrane separation procedure where the amniotic sac is separated from the uterus to help the labor progress. But at that point, it wasn't an option for me. But she did say that that was something we could explore the following week if by then I hadn't gone into labor. But actually being induced wouldn't be an option until the 27th of November. So I was getting kind of nervous because I really just wanted everything to progress naturally. But what ended up happening was on the 21st of November, me and my entire family ended up at the hospital. But it wasn't actually for me, it was for another child who was being born in the family at that very same time. So while we were at the hospital, I was visiting the restroom and noticed that my mucus plug had started to discharge. Now, you can think of the mucus plug as kind of like a cork barrier that seals your cervix, which is the opening to your uterus during pregnancy. Now, along with the amniotic sac, the mucus plug also helps to protect the baby from the outside world while you're pregnant until you're ready to deliver. Now, although losing the mucus plug is one sign that your cervix is softening and opening up your body to prepare you for childbirth, the amount of time that you might have between the loss of your mucus plug and actually going into labor can vary so much. So when I researched this online, I found that some women lose their mucus plug weeks before labor begins, whereas others lose it right as labor is starting. So it didn't really help me to gauge how I was progressing and didn't really help me to kind of get a better idea of when I was actually going to go into labor. So a couple days go by and now it's the 23rd of November. The other baby that had been born into our family was actually being discharged from the hospital that night. So my husband and I were getting ready to head over to the home of the new parents and congratulate them and welcome the new baby home. And I was sitting on the floor in front of a big full-length mirror, and I leaned forward a little bit to put on some makeup, and I felt a small gush. I looked down and immediately realized that my water broke. I called out my husband's name. He looked over at me and he also immediately realized what was happening and grabbed the phone. He was definitely a little bit nervous and he immediately called the medical support line. While he was on the line with them, answering the questions that they were asking, I was walking into the bathroom, gathering my things, and preparing mentally to head over to the hospital. It wasn't until I looked down that I realized how much fluid I was leaking. What initially just started as a small gush turned into puddles of fluid all over the tiles in the bathroom. So that really shocked me. We also called our family to let them know what was going on so they could head over to the hospital. And one thing that gave me so much peace in that moment is they said they had been praying for our baby at the exact moment that they received our phone call. So, with all of the emotions that I was experiencing that time, I felt like that really grounded me and made me feel like everything was going to be okay. And as we were driving to the hospital, I felt no pain at all. Once we parked and I got out of the car, then I realized that fluid had still been draining and soaking through my clothes. And I had on layers of clothes because it was the end of November, so it was cold. But I had been leaking so much fluid. So we immediately checked in and went to the labor and delivery unit of the hospital. I checked into my room, changed into a hospital gown, and I was connected to the sensors and everything to monitor our progress. Now, at that time, I actually had to ask the nurse to explain to me what the contraction was going to look like on the screen because I still wasn't feeling anything at all. And in a weird way, I was almost impatient to feel the pain because it was just like a fear of the unknown. And I kind of thought the sooner it started, the sooner it would pass. But sure enough, gradually, I did start to feel what I can only describe as like menstrual cramps, that same feeling that was coinciding with the peaks that graphed onto the monitor. Now, I definitely have to mention this too. Some of the staff at the hospital that I encountered, they were extremely rude, downright unprofessional, and had the absolute worst bedside manner that I have ever encountered in my life. Now, dealing with that under any other circumstance is hard enough, but dealing with it when you're going into labor for the first time is just disgusting. And you can definitely judge for yourself by the examples that I'm going to share. Now, when the physician came in to examine me, I immediately recognized him because we did have an appointment together in the past and there was nothing noteworthy about that visit at all. So I expected a pretty normal exam, but for some reason, I don't feel like he communicated to me at all. I feel like under normal circumstances, a doctor would ask, "How are you feeling?" and kind of let you know what to expect before they conduct an examination. Kind of let you know, like, okay, this is what we're checking for, this is what you might feel, do you have any questions? But he came in, seemed pretty abrupt. He did a horribly painful, invasive, and in my opinion, embarrassing exam. And I, in that moment, was just grateful that I was leaking so much fluid because he let me know that that meant that I wouldn't have to go through many more of those examinations because I had an increased risk of infection because of all of the fluid that I had been leaking. Now, naturally, as the night progressed, so did my level of discomfort. And I was told to get as much sleep as possible because I was going to need that energy later. But that's pretty impossible to do when the hospital staff are constantly coming in to check on everything. But luckily, the nurse that I had at that time was very kind and very friendly. And because I was recovering from a cold and they had some concerns about some of the readings that they were seeing for the baby, they ended up giving me an oxygen mask to help make the baby more comfortable in the womb. So I was taking long, deep breaths and hoping to compensate for any shortcomings that were caused by the cold that I was kind of recovering from. But eventually, this led me to have a really raspy voice, but that was the least of my worries. The physician was coming and going, and every single time he entered the room, I felt like I was filled with dread. I did not want to see him. He was not communicating how much I was dilated or anything else for that matter. It was almost as if he was relaying information to me through the nurse. He wouldn't directly tell me his findings. He would kind of mumble them to her and she would let me know. And at one point, he completed an examination and he encountered my husband in the doorway, and as he exited the room, he silently held up two fingers and just continued to walk down the hallway. And that peace sign, and that was his way of communicating to my husband that I was 2 centimeters dilated. Like, how bizarre is that? Now, I was told that I could receive the epidural at any time to ease the pain, and I was also told that because it takes some time for the epidural to take effect, if you do opt to get the epidural, you don't want to wait too long because it may be harder to sit still when they actually do the procedure. So when I started to feel more pain, I decided to go ahead and call in the anesthesiologist to insert the epidural. To make sure that it was working properly, he pressed an ice pack against me and I couldn't detect any sensation of cold. So I immediately did start to feel some relief, both physically and emotionally. Now, one thing that can happen when you opt to get epidural is that it can affect the rate of your contractions. So when I had first arrived at the hospital, the wonderful doctor on call, I'm being sarcastic if you can't tell, he actually called me a contraction factory. However, after getting the epidural, the rate of my contractions slowed down enough to the point that they decided to give me a medication called Pitocin via IV to speed the contractions back up again. Now, as the night was progressing, I was already getting more and more uncomfortable, and now a nurse comes in to insert the IV into a vein in my hand to administer the Pitocin medication. For whatever reason, she was having a lot of trouble with this step. She had tried to insert the needle multiple times. She was just poking me over and over again, and she just couldn't do it for whatever reason. And she actually ended up causing a vein in my hand to burst, which definitely caused a lot of pain and a lot of bruising on my hand. Eventually, she ended up calling another nurse to give it a try, and luckily, the second nurse was able to insert it, no problem. Now, the IV was inserted onto my left hand, and on my left arm, I was also wearing a blood pressure cuff. Now, every time the blood pressure cuff would inflate to take a reading throughout the labor, the IV was causing me so much pain. Like, it was to the point where the pain of the IV was worse than the actual discomfort I was experiencing from the contractions. And eventually, I even noticed that the IV was leaking. So I literally remember lifting my hand up and seeing it dripping down from my hand. So I had to get the nurse's attention and let them know what was going on, and they, you guessed it, had to remove it and reinsert it one more time. So at this point, I'm pretty exhausted. I feel like I have barely gotten any sleep. My throat is dry and raspy from having to wear the oxygen mask and from the fact that I was recovering from a cold. And my hand is aching from all the IV adventures. But at the end of the night, I still felt like I couldn't really complain because I was still doing okay, and thank God the baby's still doing okay. Now, just as I was trying to be positive, in comes Dr. Evil. Without saying a word, he walks over to the monitors in the room and examines them with the nurse standing right next to him. Immediately, I start to worry. I look over and I can see a look of concern on my husband's face too. The doctor approaches me and starts to remove some of the sensors that were attached to my stomach. These sensors are put there to monitor the fetal heart rate so that care providers can evaluate the well-being of the baby and see how the fetus is responding to conditions in the uterus. So if the baby is not getting enough oxygen, for example, or there are other issues, these sensors are supposed to help detect that. So the doctor proceeds to remove the sensors from the top of my stomach, and he starts to insert them inside my body directly to the baby. again without saying one word. After the fact, me and my husband were kind of in a state of shock because the looks of concern and the silence and the sight of blood that was caused by the sensors being moved internally, it was all just very scary. And in that moment, I felt like everything froze and time just stood still. So very fearfully, we finally managed to ask if everything was okay. The nurse is actually the one who answered us, saying that they had to move the sensors internally so that they could get better readings. The doctor re-examined the monitors and just left the room. And my husband and I were left there, absolutely terrified, feeling very concerned and very confused about what was going on. So as time continued to go by, I was getting really uncomfortable with every contraction. And I was given access to a button that I could push to release extra epidural whenever the contractions would hit. But even though I was pressing it, I still felt pain, especially on my left side. So I talked to the anesthesiologist about it, and he did the ice test again. So he applied the ice pack to my right side, and I couldn't really feel a sensation of cold. But when he applied it to my left side, I definitely felt a big difference. He said that I had the option to have the IV removed and reinserted, but there were always going to be risks associated with that procedure. And he also let me know that it is normal to feel pressure, that epidural is really only supposed to help with pain. And I just didn't feel comfortable taking the risk of redoing the procedure. So they suggested that I lay on my left side to help the epidural reach that area better. So I did follow the suggestion, but it was very uncomfortable to keep laying on one side for so many hours. Now, at this point, there was a shift change at the hospital. I was really relieved to hear this because that meant Dr. Evil would be going home. Unfortunately, I didn't anticipate that my sweet, kind nurse was going to be replaced by another nurse who was awful. So when the nurse from the second shift entered my room, I reached out to her and let her know that this was my first time going through this experience, and I was feeling a lot of discomfort from the contractions, even though I had epidural. And I let her know that I was really, really exhausted from having to lay on my left side to help with the pain that I was experiencing. And I asked her if she could give me any suggestions on anything I could do to kind of help ease the pain. And in response, she says, "Well, you're in labor, so you're going to be uncomfortable. And I actually delivered a baby for a woman last week, and it was her third child. She did it without epidural, and she did it standing up." I cannot make this stuff up. I mean, I really wonder what was going through her head to make her think that that was an appropriate response to my question. In that moment, I can't even tell you how discouraged I felt, and I already felt like a failure, and I felt like there are so many other women who are probably better equipped to handle this experience and to raise a child and be a good mother than I am. I already felt like I had failed. As the hours continued to pass by, I did eventually just change positions, even though they told me to lay on my left side to help the epidural flow to the area that was experiencing more pain. I decided that I just needed to do what felt right, and it felt right to move around a little bit in the bed and change positions, and that's what I did. When the second shift nurse returned a while later, she did let me know that they could offer me a giant exercise ball to prop up my legs with, and I was definitely open to trying anything at that point to help out the labor and help everything progress. So I did take her up on that offer, and when she brought me that giant exercise ball, she was surprised to see that even though I had the epidural, I could lift my legs up completely on my own and place them on top of the ball without any help. And I think that may be the moment when she realized that I was experiencing sensations, even though I had the epidural, that I wasn't completely numb. After some more time went by, I was feeling an enormous amount of pressure. With every contraction, I had an unbelievable urge to push. In fact, I started pushing slightly to relieve some of the pressure anytime the contraction came on, but the nurse was able to detect that, and she came and told me that it was really bad to do that because it actually puts a lot of strain and stress on the baby. So I stopped immediately, but I really had to get help from my husband in that moment, and I literally had to ask him every time he saw a contraction on the monitor to just tell me, don't push, because that's how badly my body felt ready to take that step. And I knew that I had to just be strong for the baby. But every time the doctor would come and check me, they would say I wasn't dilated enough to start pushing yet. So that was super frustrating because I felt beyond ready. And I went from hating being examined to just desperately wanting to be rechecked so that I could be given the green light. But there were definitely moments when I didn't think I could handle it anymore, when I was just so tired that I didn't feel like I could do it. But in those moments, I would just keep hearing the baby's heartbeat on the monitor, and that's really what kept me strong and helped me to get through it, because I knew deep down it was more than just what I was feeling at that time, no matter what I was going through. That helped me to remind myself that it was all temporary, everything would pass, and that there was a bigger purpose behind all of this, and I had to think about the baby, and really that gave me strength. I remember during pregnancy, I used to wonder how I would know how to push. How would I know which muscles to use? But once I started to feel how the pressure was building up inside of my body, then I realized it's not something that I really had to overthink. It was natural, and I knew that my body would guide me through the process. And once I was dilated enough to start pushing, there was one piece of advice that I feel really resonated with me from some of the classes that I had taken to prepare for labor and delivery. And that was to approach each contraction as if I was jumping into the ocean. So I would take a deep breath, like I was filling up my lungs with air, and I would hold it while I push through the contraction. And once the contraction passed, then I would release all of that breath as if I was coming to the surface of the water. Now, something about this advice really clicked with me, maybe because I love swimming, but I really feel like that helped me tremendously during the pushing part, during the actual labor. Now, while this was all taking place, I also had my husband standing beside me, and he was giving me sips of water between the contractions because I was so thirsty and so unbelievably parched. And to me, it felt like the doctor was telling me over and over again that I was close, and I felt like that was lasting forever. And she would tell me when she could see the baby's head, and she would tell me she could see his hair, and I would think, oh wow, that means he'll be out in the next push or two. But I completely forgot something that I definitely learned in some of my classes also, which is that the baby kind of goes back and forth, like in and out a few times before they actually come out completely. So even though she kept telling me I was close and she could see the baby's head and she could see the baby's hair, and I would get so encouraged and think, okay, this is the last push then, we're almost there, it still took some time. So after 22 long hours of labor and 1 hour of pushing, my baby was finally born. I don't even think the words exist to describe what it feels like to see your child for the first time. Honestly, it was very surreal. It was just a moment where I feel like, again, time just froze. And after everything that I had experienced, it was just an indescribable moment. Now, I did let the staff know beforehand that I wanted to do skin-to-skin contact with the baby. So, once the baby was born, they put him bare naked onto my bare chest. And that's supposed to have a lot of benefits for the child. And that also encourages the baby to try to latch on to nurse almost immediately. And it is so unreal to see, like, how does such a tiny newborn baby know to even do that? And in that moment, I was like thinking, wow, nursing is going to be so easy. He already knows what to do. But that could not have been farther from my experience. I will definitely get into the challenges of nursing in a different video, but for now, I'll just stick to the labor and delivery experience. So while this is going on and I'm getting more comfortable with the baby, the rest of the team is pressing on my stomach and pulling out all kinds of afterbirth and placenta from inside of me. And I did have to get stitches because I did tear, but honestly, I felt it wasn't that I was unaware of what was going on, but I was just not focused on any of it. And in that moment, I think, yeah, maybe the epidural did help because I couldn't feel the pain. I was still partially numb to it, but it was almost like it didn't even matter. It was just like a blur. It was like a distant blur of experience that was going on around me. And the only thing that was really clear in that moment was just my family. Once my family was allowed to come into the room and meet the baby, everything settled down. My husband, my son, and I got moved into the postpartum room, and during that time, the nurse came to help me use a restroom for the first time and gave me some supplies to help with bleeding and healing. So she gave sprays and pads and disposable undergarments and a squirt bottle to help with cleaning and the ice pack that felt so good. You would never think that an ice pack would feel so good, but man, that was my favorite part, as odd as that sounds. I honestly am lucky in that I don't feel like I had any major issues with this part. The postpartum recovery, I don't feel was too terrible for me personally. The nurse did keep coming in to check on me, and she would actually massage my uterus by pressing down on my stomach to make sure that it was shrinking and that there was a reduction in the bleeding. And just like during labor, they constantly tell you to get some rest, but it is virtually impossible because people are constantly coming in to check on you, to check on the baby. And during this time, I was also trying to nurse. And as I mentioned earlier, nursing was a whole different that's a whole different topic that I have to get into separately because I feel like I experienced so many challenges and emotional hurdles that I had to overcome with that process, and I definitely feel like it could be helpful to share that information as well, but I want to dedicate a separate video to that. So I think I'll go ahead and conclude this video here. I really hope that sharing my story may be helpful for someone else. And I know there were definitely moments when I was going through some hardships where I felt completely alone, but I hope this story might help to prevent that from happening to someone else. And I definitely feel very fortunate that my child and I made it through the whole experience and we're doing just fine. And I'm so grateful for the care that I did receive. And I do understand and sympathize with healthcare workers. I know that they're under a lot of stress. They have to deal with unbelievably difficult situations and they have a lot of responsibility on their shoulders. And I know they have to be away from their families during holidays to help others. Like in my case, it was right around Thanksgiving, so I definitely can empathize with what they're going through. But I definitely feel like there were some moments that could have been handled a lot better in my case, and I feel like I was in such a vulnerable position that just some better communication, better bedside manner really could have given me the emotional support that I felt like I desperately needed. I also wanted to share my experience with epidural because there may be others who are under the same impression that I was and may think that once you get epidural, everything will run smoothly and you won't feel a thing. But in reality, its purpose is to help relieve pain and not pressure. And that is a good thing because feeling pressure is what allowed me to understand that I needed to push and how I needed to push. But I am pretty confident in my case it wasn't fully effective, again, because I was able to move my legs pretty independently and because there was a significant difference in pain on my right versus my left side. I do know some friends and family who have had epidural as well, and their experience with labor was very easy and everything went super smoothly, and I wish that upon everyone. But I do feel like it's important to share what happened to me as well so that anyone else going through something similar knows that they're not alone, and even maybe just to help set expectations and help prepare someone for this type of possibility. Thanks for checking out my channel. I hope you found my content helpful, and I would really appreciate it if you would like, comment, and subscribe.